This is a sheep heart. If you look for the thicker of the of the ventricular walls, the thicker ventricular wall designates the left ventricle. And once you orient yourself to the left ventricle, you can orient yourself to the rest of the structures. The other structures that we are worried about are the layers. So on this outer layer, we have the epicardium. This muscular layer is the myocardium. And this inside layer here, where we actually can touch, is the endocardium. Those are the three layers of the heart visible on the sheep heart. Then once you look inside the ventricles, you have the chordae tendae attached to the papillary muscles. And these hold down your valves, your AV valves, your atrioventricular valves. Your atrioventricular valve on the left ventricle is going to be your mitral valve or your bicuspid valve. And these chordae tendae will hold them down so they don't flap back upwards. If you look on the other side of that, you have two halves of the right ventricle. And this right ventricle, if you open it up, you can also see the chordae tendae there, which will attach to the papillary muscle here. Then you're going to have your same tricuspid valve. If you look inside for valves, you can see the aorta, because you know that if this closes to contain the left large ventricle, it's going to exit through the aorta. So you have your aorta here, which means that you're going to pass in the process, you can see bits of it here, is going to be your semilunar aortic valve. And then your semilunar pulmonary valve is actually really hard and kind of impossible to see from here because it's been cut down. But it would be here, and you can see it pop out here.
Oh, okay.
Okay? So looking on the outside, if you're going to identify things on the outside of the heart, the larger muscular region is going to be the left ventricle.
Okay.
If you flip it over, the larger side again is the left ventricle. You can usually see more of the muscle and less of the fat. And then if you look, just orient yourself on top. So left, right, face towards you. You can usually see that you have your aorta, your pulmonary artery, and then you can see some of your superior and inferior vena cava. Here is the superior. Your inferior is hard to see on here, but that's the heart. Did that work?